lot of discussion at the moment about IV iron and who should get IV iron. I've had this discussion on my live sessions on TikTok with patients as well. They say my ferritin is 8. Do I automatically get IV iron? No, you don't. My hemoglobin is 90 grams per litre. Do I get IV iron? Not necessarily. So how do we decide who gets IV iron and who should have oral iron? Well, iron deficiency, of course, as you know, is incredibly common. We have 1.6 billion people worldwide with iron deficiency, and so we need to treat these people to get them into optimal health. Normally, we prefer oral iron if possible. Oral iron is cheap, you can take it at home. The problem is it does come with side effects, no matter which version you use. The standard therapy for iron replacement is ferrous sulfate tablets, 200 milligrams, once per day, first thing in the morning on an empty stomach, or every other day. If you take it more often, the hormone hepcidin will block further absorption. So once every day or once every other day, as I say, on an empty stomach, first thing in the morning, sip of water, no other medication, no tea, no coffee, no food. Just give it 1 hour to sit in the stomach, dissolve, and get into the bloodstream. Now, I think oral iron does not work fantastically well, especially if you have a low ferritin, if you perhaps got hair thinning, brain fog, fatigue. I'm not sure how well oral iron works. It does take many months to get your ferritin up from, say, 10, 15 up to 50, and I suspect many people never get to 50. And the ideal ferritin should be around 50 to 100 for you to feel optimally well, for your hair to regrow, for your nails to go back to normal, your skin to go back to normal, the brain fog to clear, and for you to feel good. So, as I say, oral iron is our preferred therapy. The problem is that it has side effects for many people. It causes indigestion, it causes constipation, your stools will go black. Iron tablets are quite astringent, so the body does notice when you take iron. For many people, the side effects are quite bad. Taking it every other day will reduce the side effects, of course, for many people. We also have several iron preparations available on the market. The standard one we use is ferrous sulfate, 200 milligrams, but there's also ferrous gluconate, succinate, fumarate, and bisglycinate. I think the best ones are probably gluconate in terms of being gentle or more gentle, and bisglycinate also. The old ferrous sulfate, the standard treatment, is quite harsh. So normally you would take oral iron for at least 3 months, recheck your bloods around 8 weeks, 10 weeks, see what's happened to your ferritin. Has it come up? If your hemoglobin was low, has it come up? Hopefully it has to an extent. And when those become normal, the ferritin and the hemoglobin, continue the iron for a further 3 months. Why do you take it for a further 3 months? Well, in the first few weeks of taking iron, the iron will go to all the cells in the body that require iron. It will also go to make red blood cells, which obviously we need for oxygen carriage around the body. Nothing is stored. Only the surplus iron is stored as ferritin. So if you have no surplus, you will not store anything. So the ferritin will not rise. So take iron till your indices, hemoglobin, MCV, ferritin are normal, and then a further 3 months. So we're talking about 6 months of oral iron treatments, a long time, maybe longer. Some people need to take it for a year. And then we have IV iron, intravenous iron. One infusion of intravenous iron is equivalent to taking 3 months worth of iron tablets, which is great. The problem is it needs a day ward. To give it, you need resuscitation equipment. Obviously, some people have reactions. Thankfully, not that many, but some people do, so we must be ready for any reaction that you might get. It's expensive as well, much more expensive than oral iron. And as I mentioned, the reactions, some people do have reactions. You can feel warm, your temperature may go up, you may get hives, and the worst case scenario is you have really severe reaction, but thankfully we don't see that very often. IV iron gives you the iron straight into the bloodstream. There is no need for absorption from the gut at all. So it goes straight into the blood. It goes straight to all the cells that need the iron. Also goes to the bone marrow where the red cells are made. And you feel better much faster with IV than oral. So you're getting a 3 month supply of iron in 1 hour. You don't feel better immediately. You may feel better after 1 or 2 days, or it may be 1 or 2 weeks before you start to feel better. The hemoglobin will gradually rise, the ferritin will gradually rise as well, a bit faster than oral, but you certainly should feel better quicker with the IV than the oral. Is it a one-off treatment? Not necessarily. If you have iron deficiency because of heavy periods and you still have heavy periods, the chances are you will need another iron infusion, maybe 6 months later, maybe 3 months later, maybe 1 year later. So people often have repeated iron infusions just to keep their ferritin in the optimal range and for them to feel good. So what makes us go for IV rather than oral iron? Well, as I said, we prefer you try oral iron for a while. If you get on with that, then that's fantastic. You can stick with the oral iron. If it doesn't work at all, after 8, 12 weeks, there's been no change, we may switch you to IV iron. If you have very bad side effects with the oral iron, again, we may switch you to IV iron. If you have problems like inflammatory bowel disease, Crohn's disease, you won't absorb iron by mouth because the gut is inflamed, so we will use IV iron in that setting. If you have other malabsorption type syndromes like celiac disease, then we'll use IV iron because the gut in celiac does not absorb vitamins and minerals very well. If you've had bariatric surgery for weight loss, then your stomach will not function normally, so we will give you IV iron. You will not absorb it by mouth either. If you are very symptomatic from your low iron levels, ferritin rock bottom, hemoglobin perhaps on the low side, breathlessness, extreme fatigue, quality of life very impaired, we may go straight for IV iron to try and improve your symptoms faster. But I can tell you it's tricky getting IV iron on the National Health Service at the moment. It requires space on the day unit. It needs a nurse to look after you. It's the logistics of it, as well as the expense of it, that reduces the number of IV iron infusions that we do in the National Health Service, which is why we prefer starting with the oral iron. So I'd be interested to know your experiences with IV iron. If you've had it, did it work straight away? Did it take a few weeks? Did you have any complications from it? There are some complications, of course. I cover this in my book. I published a book called Iron Deficiency, which is available on Amazon. It's also available on my TikTok shop. It's available on my website as an electronic download and as a PDF. My website, don't be put off by the name, it's resetformen.clinic, but it's for men and women. And you'll find the Iron Deficiency book there as an ebook and as a PDF. I also have other articles, including iron deficiency articles, free to download on my website. As I said, I do TikTok live every night at 8 o'clock UK time, and I have a lot of educational videos on TikTok covering iron deficiency and many other hematological and medical topics. So I'll be doing more videos like this covering hematology, anemias, B12, folate, other things like that. So subscribe so you see when I put the next video on, which will be very soon.